I want to tell you this infuriating story today, but I'm kind of on the inside with these organizations, so I don't want to name their names. But being on the inside, I think I can work quietly behind the scenes to address it. Woman in her mid-40s comes to see me on March 2nd for a concern of a melanoma, and sure enough, it looked like a melanoma. So we biopsy it, and then we wait. Usually it takes a couple days. And we wait, and we wait, and we wait, and we wait. Finally, we call on it after about a week. Well, turns out the first pathologist didn't want to read it or wasn't comfortable reading it, so they wanted to send it to the major university in our area. For the major university to read it, they have to get insurance authorization to get like a second opinion. This insurance authorization took an additional 3 weeks while this woman is going to bed every night, putting her head on her pillow, wondering, do I have melanoma? Do I need to get my affairs in order? Is my will up to date? Do I have an advance directive? How are my kids going to survive? Will I ever eat another McRib? April 2nd, today, we actually get her biopsy back 1 month to the day. And yeah, indeed, she has melanoma. Thankfully, it's one we can treat in the office just with a small little excision. She doesn't need any lymph nodes biopsy, radiation, immunotherapy, anything like that. So she's going to be okay in the long run. I've been on medical missions in developing nations where we've had to hoof specimens out of like canyons and things like that on our own 2 feet, or we've had to, send things to a distant city by this like old broken down diesel bus that would, spew smoke out of the back. And we're like, oh, I hope it makes it there. And we would get answers back quicker than it took for us to get her melanoma back in America in 2023. This story just illustrates what a bureaucratic, tangled wilderness American medicine has become. I mean, she would have gotten better service going to a developing nation and had me do a biopsy there and hoof it out of a canyon, throw it on an old diesel truck, and she would have gotten her answer back quicker. So enough complaining. I'm going to go make sure this doesn't happen to somebody else.